Good morning. It is Wednesday, September 28th. I'd like to welcome you to today's virtual news conference as we introduce the Munson Healthcare Orthopedic Institute. Next slide, please. Joining us today will be Spencer Derenzy, the Executive Director of Surgical Subspecialties and Orthopedics for Munson Healthcare. Knee and hip orthopedic surgeon, Dr. Michael Van Wagner with the Munson Healthcare Orthopedic Institute. Josh Thorington will join us, Manager of Rehabilitation Services with Mary Freebed at Munson Healthcare. And I'm Brian Lawson with Munson Healthcare Corporate Communications. I want to remind you that if you're watching us on Zoom today, you can enter your questions at any time to the Q&A function. And if you're joining us on Facebook, you can ask your questions via the comments. So feel free to send those in at any time, and we will send those questions to our panelists at the end of today's presentation with the Q&A. We start today with Spencer Derenzy, Executive Director of Surgical Subspecialties and Orthopedics, to give us an overview of the Munson Healthcare Orthopedic Institute. Spencer.
Thanks, Brian. So it's really a pleasure today to be speaking with everyone. So I want to give everyone a little background about the Munson Healthcare Orthopedic Institute, or as I will refer to it as the MOI. So the MOI really has a model of care and philosophy in which we have highly individualized and holistic approach for treating and caring for our patients. We wanted to create these pathways that are tailored and custom to help treat each patient's unique and individualized situation that they may be encountering. We're really able to do this through having subspecialized focus for our orthopedic surgeons, also through partnerships such as with Mary Freebed. And then lastly, I would say, we're big proponents of leveraging technology and looking for best practices within the orthopedic space. Next slide, please. So I think it's really special when we formed the MOI in the sense that the model of care and the philosophy was really originated with surgeon input. And the surgeons listed here, we'll talk a little bit about, but they were fundamental in really saying, how can we improve the care in Northern Michigan? How can we do it differently? And really offer this awesome experience for patients. And so Dr. Van Wagner, who will be speaking with all of you today, he is our hip and knee surgeon who really focuses on total joint reconstruction and revision work. We have Dr. McAndrews, who is a sports medicine fellowship trained surgeon. And then we have Dr. Dubiel, who's our upper extremity surgeon, focusing on everything from a little bit of the hand work all the way up to the shoulder. And so these individualized fellowships that they all took throughout their training and education process really allowed us to have these subspecialized areas that we don't always know where the access gaps are, I'll say, in terms of, Northern Michigan can be a big geography and a big area to cover. And so these individuals are based out of Traverse City. We do have a hub and spoke model. And what that means is we want to improve access throughout Northern Michigan for orthopedic care. So each of the individuals on the screen here, all of the surgeons, they do outreach to different communities around Northern Michigan. Our goal is to really keep care close to home. And so on a weekly basis, either Dr. Van Wagner or Dr. McAndrews or Dr. Dubiel, they're driving to different locations around Northern Michigan so that patients do not have to leave their community and they can have care close to home. So it's been wonderful. And as the team expands and grows over the next year, we'll be able to, again, improve that access even further. Next slide. So the MOI opened in August, and it's really exciting. Our new clinic location is on West Front Street. When it was designed and renovated, the whole process and flow that we put into the clinic at the Institute was really centered around the patient. And so the patient has the luxury of having a very smooth process at the MOI, I believe. The latest in technology, extremely brand new equipment from the x-ray machines that emit the lowest radiation possible in the industry, to just having a really close proximity to the Munson Medical Center campus has been fantastic. In terms of just having access to surgeons and other staff members if needed. If a patient pops in, we're able to really flex schedules and make sure we accommodate everybody. So that's been a really great thing so far over the last couple of months. So next slide, please. And then earlier we talked about how the MOI is leveraging technology. One of the ways we're leveraging technology is looking at, how do we incorporate robotics within the surgery realm? Not every patient needs surgery, but those that do, how do we really ensure we're, again, offering best practice and or offering solutions to care that folks may have had to drive a long distance for prior. So Munson Healthcare was the first to acquire the ROSA technology in Northern Michigan. We have a ROSA in Traverse City, and we have a ROSA at Grayling Hospital. So we're really able to have a nice network of area and coverage to provide this service. Dr. Van Wagner and Dr. McAndrews are both certified to do procedures on the ROSA, really focus on total knee arthroplasty. We have done hundreds of ROSA procedures so far, and it's been great as we're able to study and continuously improve by looking at the outcomes. But also by really offering, world-class care to these patients in Northern Michigan. So that's been really exciting for us to learn how do we help the patients in Northern Michigan. How do we invest into our communities and keep care close to home? So I think we have a video to show everybody that further explains the ROSA.
Have you met ROSA? Introducing Northern Michigan's first ROSA robotic surgical assistant, right here at Munson Healthcare Orthopedic Institute. At first glance, you might see a robot, but ROSA is not just any body. She's an integral part of our joint replacement surgical team. Ready to learn more about her life-changing technology? Let's let ROSA do the honors.
Not all knees are the same, from their shape to their range of motion, and some knees have hardware from a prior surgery. That's where I come in. I give your orthopedic team a 3D map of your knee so they can customize your new knee to your unique anatomy. No two knees are alike, and I help make sure your knee is right for you. My advanced technology can lead to less pain following your procedure, faster recovery time, and more options for patients with pre-existing joint issues or hardware. Learn more about me and meet the whole team at munsonhealthcare.org/MOI.
Have you met ROSA? Introducing Northern.
So thanks for sharing that video. One of the other components of the ROSA platform, one of the tools we're trying to leverage, and it's in early stages as we've just done some initial testing and demos, but is the MyMobility platform. And so the MyMobility platform and application really allows us to keep connected to patients. And that communication is fundamental in terms of just being able to have early detection and intervention if things do arise for the patient. There's a lot of different data points, so we're able to custom and again, tailor that approach for each patient. So this is something that we're excited about offering in the future and seeing more of for our patients in Northern Michigan. So thank you.
Thanks very much, Spencer. We'll move on to the next slide. And we are really pleased to have Dr. Michael Van Wagner with us now. As Spencer mentioned, he is a fellowship-trained knee and hip orthopedic surgeon from the Mayo Clinic, and he also happens to be a Traverse City native. So we're very fortunate to have someone of his skill and education, return home to practice medicine here in Northern Michigan. And he's going to walk us through a little bit of what patients can expect with their experience at the MOI. Dr. Van Wagner.
Thank you. Thanks for the introduction, and thanks everybody for having me on. I'm Dr. Michael Van Wagner. Like he said, I was born and raised here in Traverse City, and I'm really excited to be home and practicing in my hometown. I'm always amazed at how much this area, Northern Michigan and Traverse City, have grown, and equally amazed at how much Munson Healthcare has grown to answer that call. So as our community grows and continues to evolve, I think it's an appropriate time for Munson to start this new institute, the Munson Orthopedic Institute. And when they approached myself and my partners, Doctors McAndrews and Dubiel, about being the initial surgeons on this project, it was really an exciting time for us. Because again, as we see our community grow and we see more people coming here, retiring here, and Munson Healthcare growing as a system, we have to be able to answer that by offering highly subspecialized care right here at home. And like Spencer Derenzy mentioned, it's a hub and spoke model. So we recognize that there are hospitals that are within the Munson Healthcare system that are not just in Traverse City. And so you can access your Munson Orthopedic Institute surgeons at these outreach facilities as well, so that you don't always have to drive to Traverse City to see us and receive that same level of care. The main goal behind the Munson Orthopedic Institute is to deliver very personalized care that's centered on the patient. There's a lot of places that can offer subspecialized care. There's a lot of fellowship-trained orthopedic surgeons and very good surgeons, but I think we have to always keep in mind that Traverse City, despite its growth, and Northern Michigan, despite its growth, is still a small town at heart, and it's our job to treat patients like that. And so we'll give you world-class care with leading technology, but also offer you very personalized care where you feel like you're coming to a small town facility as well. I think the first thing you'll notice when you're a patient at the Munson Orthopedic Institute is, when you call, you should speak to a human being. If you don't, we'll call you back in a reasonable amount of time. When you come in the door, you'll be greeted with a smile. We make sure that you see the surgeon most appropriate for what your main complaint is or your main issue of pain. And we really help guide your treatment, understanding that you're always in the driver's seat of that treatment. So I strongly believe, and so do my partners, that educating your patients is first and foremost our job as surgeons. And if we do our job in educating you and teaching you about your condition, the decision of what to do treatment-wise really should be somewhat simple for you. And so we really spend time with you, educate you, and teach you about what's going on, give you all your options. Sometimes those options are surgical, sometimes they're not, and I answer all of your questions for you. If you're a patient that ends up undergoing surgery with one of us, we take you in under our umbrella, continue to educate you and prepare you for your surgery, and really do hold your hand from beginning to end through the whole process, and try to make it a very, very smooth process for you, because I think that that's the kind of care that patients deserve and that our community deserves. Next slide. So as was touched on already, we do have some pretty exciting technology in the ROSA robotic-assisted platform that is seen in both Grayling Hospital and Munson Medical Center here in Traverse City. There are several different robots out there from different vendors for total hip and knee replacement, as well as partial knee replacement surgery. And it's pretty amazing to see where this technology has gone. I mean, since I was in training, we have been doing robotic assisted surgery, and it continues to evolve and continues to improve. What we know about robotic assisted knee replacement surgery, being the most common form of robotic assisted surgery, is that it's more precise and it's more accurate. And it's fun to do those surgeries and to really see the objective data during surgery and understand that, this is a customized approach to doing knee replacement surgery. The traditional way of doing knee replacement is also a wonderful way of doing it. And for patients out there that have had it done that way, there's nothing wrong with doing it that way. I still do surgery that way as well. But every time I do a robotic assisted surgery, I'm amazed at what I learn about the knee and what the robot can teach me about an individual's knee. And it just shows me that no two people are created the same, and everybody's knee is very unique. And the robot certainly helps us create a unique plan that's customized to you. So again, after surgery, we continue to, keep you under what I call our umbrella at the MOI. We don't just operate on you and send you on your way. We follow up with you very closely. You'll see your surgeon and or one of the surgeon's advanced practice providers. We're always available to be reached by phone. And we have a very good relationship and an exciting relationship with Mary Free Bed Rehabilitation, nationally renowned rehabilitation services, where they can help you from the beginning all the way through the end of your recovery to really help make this whole process a really smooth process for our patients. We understand that surgery is a big deal. It's a big commitment for an individual and for an individual's family, and it's our job to make that as comfortable as possible for our patients.
Dr. Van Wagner, thanks very much, and we'll have you back here in just a minute for the Q&A. But I certainly appreciate you being with us today. And as Dr. Van Wagner was mentioning, as we go to the next slide, we are very fortunate at Munson Healthcare to have a world-class partner in collaboration in Mary Freebed. And Josh Thorington is here today to kind of walk us through that collaborative and that partnership and the benefit that it has for patients not only in Traverse City, but across Northern Michigan. Josh.
Thank you for the introduction. As mentioned, my name is Josh Thorington, and I am a manager of rehab services for the Mary Freebed at Munson Healthcare team. I'm also a physical therapist, and I'm really here today to talk to you about the role of physical therapy on the team and in your road to recovery. First, before I get into that, I just wanted to take a second to introduce Mary Freebed for those of you who don't know who we are. So we are a rehabilitation hospital based out of Grand Rapids, and we specialize in rehabilitation from injury. And we are fortunate enough to be partnered with the Munson Healthcare system to provide both inpatient and outpatient care to the Northern Michigan community. Our physical therapists play an important role in your road to recovery, and our goal is to optimize your recovery and your abilities after therapy through effective and efficient care. We are able to be more efficient and effective because we're on the same team as your surgeon, which allows for more improved and streamlined communication about your care with them. And additionally, being on one team, everyone from your nurse to your surgeon, the team at the hospital, and your physical therapist know exactly what to expect during the recovery process. We know where you're at prior to surgery and after surgery, and it really helps improve your outcome. And as mentioned earlier, we specialize in rehabilitation and are recognized nationally as experts in what we do. All those things together help us be more effective and efficient and help you really reach your optimal outcome after surgery. Next slide, please. In general, physical therapists are the medical experts in recovering from an injury and surgery. That might mean you may see us prior to ever seeing a surgeon as the primary way to eliminate your pain and restore your function. It might also mean that you see us for a short course of physical therapy or prehab to make some minor or major improvements prior to your surgery so that you can have the best possible outcome. And our biggest role on the team is our role after you receive surgery. Our goal is to make sure that we're able to help you improve and maintain motion, strength, and stability that the surgeons are helping you gain back. And really the biggest goal is to get you back to doing the things that you love to do. After surgery, your role with us typically starts 3 days after surgery, and that would be your first visit with a physical therapist. They'll do a comprehensive evaluation of your range of motion, your strength, your stability, balance, and as well, they will discuss and set meaningful goals with you so that we can create a recovery plan that is individualized to you and your lifestyle. It is not a cookie cutter approach. It's all based on what you as a patient need for you and your life. Next slide, please. Also what sets us apart, being partnered with the Munson Healthcare system, is we have a large footprint in Northern Michigan. So you can expect to get the same quality care really close to home. On the screen here, you can see a map and a list of all of our locations. I think worth noting is in Traverse City, we do have 6 locations in Traverse City that are part of the Mary Freebed at Munson Healthcare team. And all of our team members are part of the team and work closely with your surgeon to really make sure that you're getting the best possible outcome that you can get. That's really what I had to share today. So thanks for having me on.
Josh, thanks very much. And I want to bring in each one of our panelists now, Dr. Van Wagner and Spencer Derenzy, just to answer a few questions to wrap us up. Josh, I'll start with you. After a hip or knee replacement, can you talk a little bit about what the patient can expect from a standpoint of the kind of physical therapy program you might put together, and maybe even a little more detail about what that collaboration and communication between you and provider is like.
Yeah, so really at that first visit, when we do our comprehensive evaluation, we're going to take a look at how the patient is presenting after surgery. So we're going to take a peek at the range of motion, their strength, their stability, how you're walking, how you're moving, getting up and down out of a chair, out of bed, in and out of a car. And we're also going to talk with the patient about what's really important for them and what they're hoping to gain after being done with physical therapy. And so we're going to create a plan really that helps them meet their goals based on individually how they're presenting. So typically we see patients 2 to 3 times a week, and it can be anywhere from 1 month to 3 months, just really depending on the patient's abilities and how they're recovering. And then as far as communication with physicians and being part of that team, again, it's really, really streamlined now that we are partnered with the team of surgeons, and we're all on the same team. We meet, we know what to expect, we know what the surgeon expects, we know what's been communicated with the patient, and we can really help reinforce that and really optimize the recovery.
Dr. Van Wagner, can you talk a little bit about how long Munson Healthcare has been using ROSA here in the region, and maybe even just touch a little bit on some of the outcomes and results, maybe any trends that you've seen with those procedures that have been performed?
Yeah, so we got the robotic technology up here last summer. I think I did the first case in Traverse City. Spencer, do you have the exact date of that? It would have been late summer, early fall of last year.
It was in September.
Yeah, so September of last year, and it has taken off from there quite a bit. Again, you know, for total knee and partial knee replacement, if you're a candidate for the traditional way, and the majority of the time you're a candidate to have it done robotically, I think that's a question a lot of patients have. And again, I know I touched on this, and I always want to reiterate, doing it the traditional way is also an excellent way, and I still do it that way, and there's certainly a place for that. Robotic technology is not going anywhere. Once it's introduced into medicine or surgical field, it always stays, and it always continues to improve and evolve. And so it's a commitment from Munson and from the surgeons in my group to our region, really to deliver access to this kind of technology. As far as the outcomes I see, this is something where, you know, you can ask me what I see with my personal patients, and I can answer that. With the robotic assisted patients that have knee replacement surgery, I think recover absolutely excellent. I do think that there is a difference in my personal practice. It will take a good decade of good 10-year data before we can say with certainty as a medical or surgical community whether or not robotic assisted surgery is better or leads to better outcomes than the traditional method. Of course, it's not, there's no downside to using it, but you know, it will take a good 10 years to get the data together to where I would, as a medical professional or surgical professional, comfortably say with certainty this is better. What we do know, it's more accurate and it's more precise than doing it traditionally. And in my opinion, that's a good enough argument to do it and to offer it to a patient. So that's why I do. And I've had great success with it.
Thank you, Dr. Van Wagner. Spencer, I'd like to bring you in, for a question. We talk about knee and hip replacement, but there's really a broad number of services that the MOI is offering. Can you talk about what the demand has been like from a standpoint of some of those other subspecialties, and maybe even look a little ahead into the future as to what we can expect to see at the MOI as we get 6, 12, 18 months down the road?
Yeah, thanks, Brian. Great question. So I can tell you, we talk a lot about joints and that with Dr. Van Wagner, but from, having a very experienced and very seasoned sports medicine surgeon like Dr. Pete McAndrews on the team, we've seen a lot of interest in that. And so he's been extremely busy very quickly. as he's very passionate about the community. And so, you know, he likes to partner with the school systems. He likes to do a lot of outreach. And from that standpoint, he's looking to grow the sports medicine practice, as well as, you know, potentially future partners as we're in the recruitment phase. I would also like to highlight that, you know, with Matt Dubiel, you know, it's Northern Michigan, so everyone wants to do, you know, outdoor activities and, you know, have a lot of fun doing different things, whether it's mountain biking or, you know, some kind of water sport, et cetera. And so we see a lot of injuries, and both Dr. McAndrews and Dr. Dubiel are treating those. You know, whether it's shoveling snow or this or that, or chopping wood, we have a lot of shoulder injuries up here. And so, you know, I know Dr. Dubiel is already, you know, having some full clinic days and helping a lot of patients. But as we look to the future, you know, we have a foot and ankle surgeon coming next summer. So we're really excited about, you know, welcoming him to the team. Currently in Northern Michigan and in the general vicinity here, we do not have a foot and ankle surgeon. So that's going to be awesome to have that expertise and fellowship trained surgeon on our team. We do have some additional surgeons coming for the orthopedic trauma program. I think that's something that we see a lot of tourism in Northern Michigan, and we want to be able to offer orthopedic trauma services 7 days a week. So really excited about those two individuals joining us next summer and elevating the ortho trauma program. And beyond that, you know, we have other candidates that I think have found the philosophy and the care model to be very attractive. And even though we're not recruiting, I think within the orthopedic field, the word's gotten out. And so we have a lot of folks sending us their CVs and resumes, and we're constantly evaluating the need of the community and fit. So that's ongoing.
Spencer, how many ROSA procedures have been performed as we look over the last year since last September? And has that been on par with what was expected, less than, or exceeded expectation?
So I'll have to look at the exact numbers. The last time I checked, we were a little north for Dr. VanWagner himself. I want to say we were a little north of 125 for him over, I think, a nine-month period. So that was more than we expected. We were expecting somewhere around 80 to 90, you know, ROSA procedures, and I think, you know, Dr. VanWagner has been extremely committed to the patients and to his practice and making sure access is timely. And I think that's really why we've seen those elevated numbers. The guy doesn't take a vacation, so, you know, patients are first in his book.
Dr. VanWagner, does someone need a referral to come to the MOI?
So getting access to get in with us and see us, you can go, of course, the traditional route of having your primary care physician or provider refer you to us. You can also go online, and there's an easy access on there for patients where they can fill out a form, and we can contact them and discuss with them whether they'd be a candidate to get in with for an appointment with us. And of course, we always take self-referrals. So again, this is all about the patient and access. And so we want to be an institute for our community and for the patients in this community. And so we should be accessible. And again, we also have outreach. And so you can find us at some of the other outlying hospitals on occasion as well. And so, you know, if we're ever not accessible or you ever have a hard time getting in, I'd like to know that so we can improve that. But our goal right now is to be as accessible as possible for our patients.
You know, going back, we talked a little bit about you growing up here in Traverse City and now returning. And what some may not know about Dr. VanWagner is he was a Division I hockey player, a defenseman for the Michigan Tech Huskies. And I wonder if you could talk a little bit about how your experience as an athlete kind of started you on this path to orthopedics.
Oh yeah, we're going way back there to the glory days. Yeah, so I played at Michigan Tech, and you know, when I was there, I ended up having a medical redshirt year because I had surgery on both of my hips. And then after that, I never quite recovered. I did finish my career. I did my 4 years there plus one medical redshirt year. And because of the surgeries I had hand surgery, I had knee surgery, I had both my hips operated on. My late father was an orthopedic surgeon. And so I think my path towards orthopedics was pretty much laid out for me. at a young age, and then my own injuries led me to do this as well. I chose hip and knee replacement surgery because those were the patients that I felt during residency really were the most fun to treat for me, because they're patients that have usually a chronic condition. They've been struggling for a long time with knee or hip pain, and it's gotten in the way of their life and started preventing them from doing the things they need to do, love to do, or want to do. And it's pretty exciting to offer them a new joint, a hip or a knee, and watch them recover from that and get back to doing those things that they had previously struggled doing. It really is a life-changing procedure, both hip and knee replacement surgery, and that's why I got into that subspecialty. And yeah, my history in sports injuries led me towards orthopedics.
In regards to the questions that you get most often from patients about robotic-assisted surgery or just hip and knee replacement in general, what are the main concerns, and what are those things that you most frequently address?
So I think it's important for patients to know, hip and knee replacement surgery are two very different surgeries with two very different recovery pathways. By and large, the majority of the time, a hip replacement surgery is an easier surgery for a patient to recover from, a little bit of a faster recovery. Knee replacement surgery, it takes time. It's a surgery that takes a lot of commitment on the patient's end as well. I always tell the patients that my job is the easy part, theirs is the hard part after surgery. And the question they ask most often is it going to hurt? How long will it take for me to recover and get back to my life? And I really walk them through that, help educate them. Of course, everybody's different. We're all very unique, but it's a very fair question. And I spend a lot of time educating patients on that, because it is a big deal. It's a big surgery, and the recovery is something that should be taken seriously.
Josh, I want to pass along a question to you now about Mary Free Bed, and an opportunity to educate even more about those services. What do you think sets Mary Free Bed at Munson Healthcare apart, perhaps from other physical therapy organizations? What advantages does a patient get from this partnership, do you think?
Yeah, well, a couple of things come to mind. Being a rehabilitation hospital, we specialize in rehabilitation. So that is all we do all day, every day. So we're not doing, acute care or cancer care like some other hospital systems. We have a primary focus on rehabilitation. Specifically in Northern Michigan, I think our partnership with the Munson Healthcare system also sets us apart, because we have a large team. We have lots and lots of team members that are physical therapists, a lot of specialists. So I have a board certification in sports specialty. We have orthopedic specialists. We have a lot of resources throughout our system to really strengthen the care that we provide to the community. And then we have, we're a very, very patient-centered group. Every day when we come in, we know that we have the ability to improve people's lives, and we think that's special, and we don't take it for granted. And so we keep the patient at the center of everything we do.
Thank you, Josh. Dr. Van Wagner mentioned that you received fellowship training at the Mayo Clinic. I'm wondering, how did your experience at Mayo shape the way that you practice orthopedics, and maybe shape the way in which patients are cared for at the MOI?
So I did my hip and knee reconstruction fellowship down at the Mayo Clinic in Florida. My partner, Dr. Dubiel, did his up in Rochester for shoulder and elbow. I'll leave it this way. There's a reason why that healthcare system, that institution is number one in the world, what they do. And it's because they center everything on the patient. And I think it's easy to lose sight of that for hospitals, healthcare systems, physicians, private practice, whatever it might be, especially in modern day medicine. But I think if we refocus ourselves on what matters most, and that's our patients, we can at least strive to be somewhere close to an institution like Mayo. So that's really what motivated me when I was down there during my training. The fact that the patients felt like they were always at the very center of their care. They didn't feel like they were just a number. that's really, really a hard thing to do nowadays in medicine. And it's something that we are going to strive for every single day at the MOI, and our surgeons and providers, administrators in the healthcare system, our rehabilitation services, everything need to be on the same page there. And they're the most important part of this puzzle, and that's the patient. And that's really all it should be about. I mean, this is healthcare. And I understand that, healthcare is also a business, but our patients should never feel that. They should feel like this is all about them and their healthcare issues.
Spencer, I want to wrap up with one more question to you, and I feel like we've kind of talked about this subject across today's virtual news conference, but it's always good to sum up once again what differentiates the MOI from a standpoint of patient care and orthopedics in your mind.
Yeah, so it's honestly several things. It's not just one. So I think it's a couple of things. One, it's our accessibility that we've really focused on in terms of making sure our surgeons go to the patient versus the patients coming to the surgeon. So we're really focused on that and developing outreach and access to care. I think one of the prior question you had asked Josh, what makes Mary Free Bed special is, the partnership with us, starts with prehab, but then also, Mary Free Bed has their therapist in the hospital seeing, Dr. VanWagner and the other MOI patients post-operatively for evaluation and, getting that treatment in the hospital going very early on. And the handoff with that to the outpatient team and Josh's team it's fantastic because they're on the same team. So the communication is streamlined, and seeing that handoff from inpatient to outpatient is not always the easiest. And I think that's something we've been very grateful for with Mary Free Bed. And then what also makes us special is I would say our flexibility to customize and tailor our approach to every single patient. So our Nurse Navigator program within the MOI is extremely special because every patient may need different resources at home. They may need different resources to get to the hospital. And so, we're able to sit down with that patient, their family, their loved ones, and really figure out what are the different case management, care management resources we have in the community that we can support them with. So it's just this deeper dive and an additional resource that we always want to make sure that the patients have. And then lastly, I'll say it's the team members that make it special, because it doesn't matter, to Mike's point earlier, Dr. Van Wagner and Dr. McAndrews and Dr. DeBeal, we all believe in this throughout. Doesn't matter if it's, the receptionist, doesn't matter if it's the MA or the PA or the physician or the administrator or the physical therapist, doesn't matter who it is on the team. We all have come together knowing that everything we do every single day, it's about the patient. So whether that's calling the patient back timely, or creating an access and someone staying late to see the patient, or moving schedules around to accommodate, the list goes on. But we have all agreed that the patient is what matters, and we'll do anything, we'll go above and beyond to make that experience and outcome the best for that patient.
Spencer Derenzy, Josh Thorington, Dr. Michael Van Wagner, thank you so much for taking some time to speak with us today and provide some information about this new Orthopedic Institute through Munson Healthcare. We really appreciate you being with us. Let's go to one final slide. If you would like more information on the Munson Healthcare Orthopedic Institute or any of the services of Munson Healthcare, you can find it in a number of ways. You can sign up for our newsletter, munsonhealthcare.org/newsletter. Also, many of you joined us on Facebook today, but you can also follow us on LinkedIn, Instagram, Twitter, and YouTube. And of course, you can find plenty of information at munsonhealthcare.org. I'd like to thank all of you for participating in today's virtual news conference and joining us. And until next time, we'll wish you good health and have a good day.